Hi everyone, this is Ryan Valenciano. So today we're going to be doing a few cervical tests to go and check. Right over here we have my client, Brian Slade. So the first thing that we're going to be working with is active AO flexion and extension and active AA rotation. So let's get started. First up, so Brian, can I have you bring your head down like you're doing a slight nod? And I want it to be like you're trying to squeeze like a small tangerine, like a cutie. Notice that this is a very slight motion, so relax from here. Next up, we have AO extension. So Brian, can I have you slightly bring your head up, look on the ceiling? And once again, it is a very small motion. So bring it back to neutral. Perfect. Any changes with that? No. Good to hear. So this next one, we have AA rotation. So Brian, I want you to bring your right ear to your right shoulder. And I want you to look up at my hand at the opposite direction. All right, and relax. Same thing, can you bring your left ear to your left shoulder? And I want you to go and turn your head to look at my hand. Perfect, and relax. Any changes with that?
No.
Great. So that's it for now. Thank you. Hi everyone, this is Ryan again. Next up, we have the sharp purser test. So for this, we're testing the integrity of the transverse ligament and how it moves along C1 and C2. So for this one, I'm going to have our client over here go into a little bit of flexion. So, all right, can you bring it a little forward? And with a key grip, I'm going to go on his C2 and press. But Brian, are you feeling any symptoms right now?
Oh, yes, just a little bit.
All right, so for this, we're going to be pressing against C2 and against the forehead right over here and apply some pressure.
Oh, it feels better.
And the client should notice that there is a change in the difference. That's it for this time. See you next time. Hi, Ryan here. So this next test that we have is the alar ligament test. We're going to be checking for whether or not it is intact. And we'll do this by doing lateral flexion on the C2 spinous process. So first of all, we're going to be palpating out C2 process. Perfect. And then, holding our hand, we're going to go and do a lateral flexion. And I should feel the C2 spinous process pop into my finger. Brian, how does that feel?
Good.
All right, and switching sides, supporting the neck. Checking once again. Brian, how does that feel?
Good.
So the fact that I felt both of the alar ligaments pop into my finger shows that it is intact and he's able to do rotation. That's it for today. Thank you. Hi there, everyone. This is Ryan again. The next test that we have is the transverse ligament test. So for this one, we're going to be using 2 fingers, and we are going to test whether or not the transverse ligament is intact. So with these 2 fingers, we are going to look for C1 and gently push up on it, firm enough, but not too much that we put them into extension. And while we're doing this, we're going to be looking at eye movement, as well as if there's any facial paralysis, difficulty with breathing. And Brian, how do you feel?
I feel good.
So for this test, we actually want to talk to our client more, and part of that is to check if there's any slurred speech. So any changes, Brian?
No, there is not any changes.
All right, so hold this for 15 to 20 seconds and relax. That's it for the transverse ligament test. I'll see you next time. Hi there, it's Ryan again. So this time, instead of doing active motion, we're going to be looking at some passive motions of the neck. So we're going to be checking for AO flexion and extension, as well as combined flexion and extension with some rotation involved. So the first thing I want to do is I want to support my client's head, and I want to make sure I have a firm grasp on them, and I'm going to bring them into flexion, into that slight nodding, and I'm also going to go and bring them into extension, that backward motion. Brian, are there any changes to that?
No, I feel the same as I did before you started.
Perfect. So notice that it is very slight motions as well, and now we're going to do a combined motion, adding in the rotation. So we're going to put him back into flexion, and we're going to go into rotation, And we are watching the neck to make sure that there's no excessive motion and bringing it back to the other side. For here, we're also doing extension with rotation. So bringing him into extension. Doing rotation. And back again to the other side. We're just going to place the client's head nice and safe. And that's it for the test. And I'll see you again next time. Hey, Ryan here. So for this next one, we have passive range of motion with the AA rotation. So for this one, what we want to do is we want to support them once again. And we are going to bring them into maximum lateral flexion. And from here, we're going to slip our hand underneath, support them, and turn their head for that AA rotation. Now we're doing this motion to go and isolate it to the AA, as well as making sure that we are not moving any of the mid to lower cervical portion. So bringing him back in. And once again, I'm going to bring it to that lateral flexion, supporting the neck underneath, doing that turn. And any changes, Brian?
No.
Great. And that's it for the AA rotation. See you next time. Hi there, Ryan here once again. Now we're moving from the neck motions and going and checking the motions of the jaw. So what we do want to take a look at is opening of the mouth, lateral deviation or moving from side to side, and protrusion or jutting of the jaw. So we have this useful tool right here, and this will help us guide the motions for this. So this is Brian's card. And the first one we are going to be checking is opening of the mouth. So Brian, could you come a little forward? And can you open your mouth for me? Perfect. So I'm sticking it in his two middle teeth, and I'll ask him to open his mouth as wide as he can. Perfect, and relax. Wow. Next up, we have lateral deviation, so lining up with the bottom two teeth. And then, Brian, can you shift it to the left as far as you can? Perfect. And shift it to the right as far as you can. Awesome. So, one thing for this one, you really want to make sure that the teeth are visible, so you can press down on the gum to show it. And it should be a very small motion without the head moving. Last up, we're going to check for protrusion. So sticking the card right into here. You want to check the difference between the top teeth and the bottom teeth. And Ryan, can you jut your bottom jaw forward? Perfect. Wow, that was a big one. And that's it for today. So see you next time. Thank you. This is the final test for today. What we're going to be doing is we're going to be checking the motions of his TMJ, his temporomandibular joint. So for this, what I am going to do is I'm going to have my fingers right over here near his earlobes, and I'm going to ask him to open his mouth and close his mouth and open his mouth. So we sit in front of the client to check for symmetry of movement, along if there's any clickings or if it causes any discomfort. So Ryan, relax. Do you feel any discomfort as you're doing this?
No.
Perfect. So that's it for today. I'll see you next time. Thank you. Hi there, Ryan here. Thank you so much for watching our video. As you can see, there's a lot of importance between patient and therapist communication. So it's always important to check, are there any symptoms following any of the motions that you do? Make sure that you communicate with your client when you're making any changes, and make sure that you create a very comfortable environment for them. It's important to understand this positive relationship that we as therapists share with our clients. So hope to catch you again next time, and hope to see you soon. That's it for now.